When it comes to mental health, there are a lot of myths out there. Can you tell the difference between a mental health myth and fact? Let's take a moment to learn the truth about the most common mental health myths. Number 1, myth or fact. Mental health problems don't affect me. Myth. Mental health problems are actually very common. Every year, 1 in 4 American adults experiences a mental health issue. 1 in 10 young people experiences a period of major depression. 1 in 25 Americans lives with a serious mental illness, such as schizophrenia, bipolar disorder, or major depression. And suicide is the 10th leading cause of death in the United States, more than double the number of lives lost to homicide. Number 2, myth or fact. People with mental health problems are violent and unpredictable. Myth. The vast majority of people with mental health problems are no more likely to be violent than anyone else. Most people with mental illness are not violent, and only 3 to 5% of violent acts can be attributed to individuals living with a serious mental illness. In fact, people with severe mental illnesses are over 10 times more likely to be victims of violent crime than the general population. You probably know someone with a mental health problem and don't even realize it, because many people with mental health problems are highly active and productive members of our communities. 3. Myth or fact. People with mental health needs, even those who are managing their mental illness, cannot tolerate the stress of holding down a job. Myth. People with mental health problems are just as productive as other employees. Employers who hire people with mental health problems report good attendance and punctuality, as well as motivation, good work, and job tenure on par with or greater than other employees. When employees with mental health problems receive effective treatment, it can result in lower total medical costs, increased productivity, lower absenteeism, and decreased disability costs. 4. Myth or fact. Personality weakness or character flaws cause mental health problems. People with mental health problems can snap out of it if they try hard enough. Myth. Mental health problems have nothing to do with being lazy or weak, and many people need help to get better. Many factors contribute to mental health problems, including biological factors such as genes, physical illness, injury, or brain chemistry, life experiences such as trauma or a history of abuse, and a family history of mental health problems. People with mental health problems can get better, and many recover completely. 5. Myth or fact. There is no hope for people with mental health problems. Once a friend or family member develops mental health problems, he or she will never recover. Myth. Studies show that people with mental health problems get better and many recover completely. Recovery refers to the process in which people are able to live, work, learn, and participate fully in their communities. There are more treatments, services, and community support systems than ever before, and they work. 6. Myth or fact. Therapy and self-help are a waste of time. Why bother when you can just take a pill? Myth. Treatment for mental health problems varies depending on the individual and could include medication, therapy, or both. Many individuals work with a support system during the healing and recovery process. Quite often, a combination of medication and supportive counseling is most effective. 7. Myth or fact. Most people with mental illness get the treatment they need. Myth. Are you starting to see a pattern? The fact is only 40% of adults in the U.S. with a mental health condition receive mental health services. A combination of stigma and barriers to access prevent many people from receiving the treatment they need. 8. Myth or fact. I can't do anything for a person with a mental health problem. Myth. This might be the greatest myth of all. You can actually make a very big difference. Friends, family members, and coworkers can be important influences to help someone get the treatment and services they need by reaching out and letting them know you are available to help. Helping them access mental health services. Learning and sharing the facts about mental health, especially if you hear something that isn't true. Treating them with respect, just as you would anyone else. And finally, refusing to define them by their diagnosis and using labels such as crazy. Now you know the myths from the facts about mental illness. The next time you hear a myth, you can support people with mental illness by sharing the facts.